Hi, this is Daniel Tarlow at the Jerusalem Center for Craniosacral Therapy. I'd like to tell you today about craniosacral therapy for babies because this is one of the most effective areas that craniosacral therapy affects, and is also very well known for the amazing work it does with lots of different issues that babies have. For example, babies who suffer from colic, which there's very little remedies that help that. Craniosacral therapy is an excellent treatment. Sleeping conditions, sleeping issues, babies who aren't sleeping or wake up a lot. So craniosacral therapy again has excellent results helping sleeping issues. Issues to do with feeding, breastfeeding, or any normal feeding. If a baby is having a problem feeding, or they've had a problem with the use of their tongue, they've had a tongue tie, anything like that. So craniosacral therapy is really an excellent way to help your baby. Finally, the last two things I'd like to mention. One is torticollis. Torticollis is a condition where the baby turns their head mainly to one side, not the other. And sometimes this comes along with feeding issues for reasons that I'll explain in later videos. And finally is a condition called plagiocephaly, which is a condition where the head has become malformed or misshaped, and sometimes that's happened because of the way the baby has been lying in the womb, and that's caused the malformation of the skull. Other times it's the way the baby is left to be put down in bed, and that causes a malformation over time as the baby stays on the head on their back. Sorry, their head can become flattened. So there's that. There is, of course, a third form of plagiocephaly, which is caused by the fusion, the closing up of the sutures in the skull, and with that there is success as well. So with all these forms of plagiocephaly, it's definitely worth seeing an expert craniosacral therapist and treating babies like myself, and having a set of treatments for these conditions. Now, some people say they get referred to me, but they don't know what craniosacral therapy is. So I'd just like to explain that now very quickly. So craniosacral therapy is a very light and gentle, hands-on manipulative technique. The word manipulative, it's not something with lots of moving and high pressure techniques. It's a very light and gentle, simple treatment, and it's a very often very relaxing, and not just the babies, adults as well very much enjoy having and receiving craniosacral therapy, and often calms them down and relaxes them a lot. And craniosacral therapy in a nutshell really has an excellent effect on releasing tensions and tightnesses in the muscles, in the skeletal system, and the fascia. Fascia is a section of tissue which forms around muscles and organs, and different tensions can form within this tissue and can have a negative effect not just on the muscles but also on the nervous system. So we lightly and gently work to release those tensions in the body. And in order for you to have a bit of a better idea, I'd like you to watch a short video now of me treating a young 2-month-old baby, and you'll see how light and gentle the treatments are. Thank you.